The female reproductive anatomy includes both external and internal parts. The function of the external genitals is to protect the internal parts from infection and allow sperm to enter the vagina. The vulva is the collective name for all the external genitals. A lot of people mistakenly use the term vagina to describe all female reproductive parts. However, the vagina is its structure located inside the body. The main parts of the vulva or external genitals are 1. Labia majora. The labia majora, large lips, enclose and protect the other external reproductive organs. During puberty, hair growth occurs on the skin of the labia majora, which also contains sweat and oil-secreting glands. 2. Labia minora. The labia minora, small lips, can have a variety of sizes and shapes. They lie just inside the labia majora and surround the opening to the vagina, the canal that joins the lower part of the uterus to the outside of the body, and urethra, the tube that carries pee from the bladder to the outside of the body. This skin is very delicate and can become easily irritated and swollen. 3. Clitoris. The two labia minora meet at the clitoris, a small, sensitive protrusion that's comparable to a penis in men. The clitoris is covered by a fold of skin called the prepuce and is very sensitive to stimulation. 4. Vaginal opening. The vaginal opening allows menstrual blood and babies to exit the body. The penis can go inside the vagina through the vaginal opening. 5. Hymen. The hymen is a piece of tissue covering or surrounding part of the vaginal opening. It's formed during development and present during birth. 6. Opening to the urethra. The opening to the urethra is where the pee comes from. What are the external parts of the male reproductive system? Most of the male reproductive system, genitals or genitally, is on the outside of your abdominal cavity or pelvis. The external body parts include 1. Penis. The penis is the male organ for sexual intercourse. It contains many sensitive nerve endings and has two main functions, which include sexual intercourse. During erotic stimulation, the penis undergoes erection, becoming engorged with blood. Following emission, mixing of the components of semen in the prostatic urethra, ejaculation can occur, whereby semen moves out of the urethra through the external urethral orifice. Finally, the penis undergoes remission, returning to a flaccid state. Micturition. The penis also has an important urinary role. It contains the urethra, which carries urine from the bladder to the external urethral orifice, where it is expelled from the body. The penis has 3 parts, which include root. The root is the base of your penis. It attaches to the wall of your abdomen. Body, shaft. The body has a shape like a tube or cylinder. It consists of 3 internal chambers. The 2 larger chambers are the corpora cavernosa, and the third chamber is the corpus spongiosum. The corpora cavernosa runs side by side, while the corpus spongiosum surrounds your urethra. There's a special, sponge-like erectile tissue inside these chambers. The erectile tissue contains thousands of spaces. During sexual arousal, the spaces fill with blood, and your penis becomes hard and rigid. Erection. An erection allows you to have penetrative sex. The skin of your penis is loose and stretchy, which lets it change size when you have an erection. Glans, head. The glans is the cone-shaped tip of your penis. A loose layer of skin, foreskin, covers your glans. Healthcare providers sometimes surgically remove the foreskin, circumcision. Erectile tissues of the penis. The erectile tissues fill with blood during sexual arousal, producing an erection. The root and body of the penis are spanned by 3 masses of erectile tissue. In the root, these tissues are known as the left and right crura and the bulb of the penis. The bulb is situated in the midline of the penile root and is traversed by the urethra. The left and right crura are located laterally, attached to the ipsilateral ischial ramus, and covered by the paired ischiocavernosal muscles. The erectile tissues continue into the body of the penis. The left and right crura continue anteriorly into the dorsal part of the penis. They form the 2 corpora cavernosa. They are separated by the septum of the penis, although often incompletely. The bulb forms the corpus spongiosum, which lies ventrally. The male urethra runs through the corpus spongiosum to prevent it from becoming occluded. During erection, the corpus spongiosum fills to a reduced pressure. Distally, the corpus spongiosum expands to form the glans penis. Muscles of the penis. There are 4 muscles located in the root of the penis, which include bulbospongiosus. This is associated with the bulb of the penis. It contracts to empty the spongy urethra of any residual semen and urine. The anterior fibers also aid in maintaining erection by increasing the pressure in the bulb of the penis. Ischiocavernosus surrounds the left and right crura of the penis. It contracts to force blood from the cavernous spaces in the crura into the corpora cavernosa. This helps maintain erection. Facial coverings of the penis. Each mass of erectile tissue has 2 facial coverings. The most superficial layer, immediately under the skin, is the external fascia of Coles, which is in continuity with the fascia of Scarpa, which covers the abdominal wall. A deeper stratum is the deep fascia of the penis, also known as Buck's fascia. This is a continuation of the deep perineal fascia and forms a strong membranous covering that holds all 3 erectile tissues together. Underneath the deep fascia is the strong fascia called tunica albuginea, forming an individual capsule around each cavernous body and fused in the midline. The incomplete septum between the 2 corpora is comprised of tunica albuginea, ligaments of the penis. The root of the penis is supported by 2 ligaments, which attach it to the surrounding structures. These include suspensory ligament, a condensation of deep fascia. It connects the erectile bodies of the penis to the pubic symphysis. Fundiform ligament, a condensation of abdominal subcutaneous tissue. It runs down from the linea alba, surrounding the penis like a sling, and attaching to the pubic symphysis. The skin of the penis. The skin of the penis is more heavily pigmented than that of the rest of the body. It is connected to the underlying fascias by loose connective tissue. The prepuce, foreskin, is a double layer of skin and fascia located at the neck of the glans. It covers the glans to a variable extent. The prepuce is connected to the surface of the glans by the frenulum, a median fold of skin on the ventral surface of the penis. The potential space between the glans and prepuce is termed the preputial sac. Vasculature of the penis. The penis receives arterial supply from 3 sources, which include dorsal arteries of the penis, deep arteries of the penis, bulbourethral artery. These arteries are all branches of the internal pudendal artery. This vessel arises from the anterior division of the internal iliac artery. Venous blood is drained from the penis by paired veins. The cavernous spaces are drained by the deep dorsal vein of the penis, which empties into the prostatic venous plexus. The superficial dorsal veins drain the superficial structures of the penis, such as the skin and cutaneous tissues. Innervation of the penis. The penis is supplied by S2, S4 spinal cord segments and spinal ganglia, sensory and sympathetic innervation to the skin and glands. Penis is supplied by the dorsal nerve of the penis, a branch of the pudendal nerve. Parasympathetic innervation is carried by cavernous nerves from the periprostatic nerve plexus and is responsible for the vascular changes that cause erection. In most people, the opening of the urethra is at the tip of the glans. The urethra transports pee and semen out of your body. Semen contains sperm. You expel, ejaculate, semen through the end of your penis when you reach sexual climax, orgasm. When your penis is erect, your corpora cavernosa press against the part of your urethra where pee flows. This blocks your pee flow so that only semen ejaculates when you orgasm. What is the normal size of the penis? Studies suggest that the average penis is about 3.5 inches, 8.9 centimeters, when flaccid, soft, and a little more than 5 inches, 13 centimeters, when erect. 2. Scrotum. The scrotum is a fibromuscular cutaneous sac located between the penis and anus. It is dual-chambered, forming an expansion of the perineum. Embryologically, the scrotum is derived from the paired genital swellings. During development, the genital swellings fuse in the midline. In the adult, this fusion is marked by the scrotal raphe. The scrotum is biologically homologous to the labia majora. Your scrotum is the loose, pouch-like sac of skin that hangs behind your penis. It holds your testicles, testes, as well as nerves and blood vessels. Your scrotum protects your testicles and provides a sort of climate control system. For normal sperm development, your testes must be at a temperature that's slightly cooler than body temperature, between 97 and 99 degrees Fahrenheit or 36 and 37 degrees Celsius. Special muscles in the wall of your scrotum let it contract, tighten, and relax. Your scrotum contracts to move your testicles closer to your body for warmth and protection. It relaxes away from your body to cool them. The scrotum contains three major, paired structures, which include testis. This is the site of sperm production. Epididymis. This is situated at the head of each testicle. It functions as a storage reservoir for sperm. Spermatic cord. This is a collection of muscle fibers, vessels, nerves, and ducts that run to and from the testes. There are also muscle fibers located within the scrotum. The dartus muscle is a sheet of smooth muscle situated immediately underneath the skin. It acts to help regulate the temperature of the scrotum. By wrinkling the skin, this decreases surface area, reducing heat loss. Neurovascular supply of the scrotum. The scrotum receives neurovascular supply from the nearby vessels and nerves. This is in contrast to the testes, which carry their vessels, nerves, and lymph drainage from the abdomen during their development. Blood vessels of the scrotum. The scrotum receives arterial supply from the anterior and posterior scrotal arteries. The anterior scrotal artery arises from the external pudendal artery, while the posterior is derived from the internal pudendal artery. The scrotal veins follow the major arteries, draining into the external pudendal veins. Nerve supply of the scrotum. Cutaneous innervation to the scrotum is supplied via several nerves, according to the topography, which includes anterior and anterolateral aspect. Anterior scrotal nerves derive from the genital branch of the genitofemoral nerve and ilioinguinal nerve. Posterior aspect. Posterior scrotal nerves are derived from the perineal branches of the pudendal nerve and the posterior femoral cutaneous nerve. Lymphatics of the scrotum. The lymphatic fluid from the scrotum drains to the nearby superficial inguinal nodes. 3. Testicles. Testes. The testes and epididymis are paired structures located within the scrotum. The testes are the site of sperm production and hormone synthesis, while the epididymis has a role in the storage of sperm. Your testicles, testes, are oval-shaped organs that lie in your scrotum. They're about the size of two large olives. The spermatic cord holds your testicles in place and supplies them with blood. Most people have two testicles on the left and right side of their scrotum. Your testicles make testosterone and produce sperm. Within your testicles are coiled masses of tubes. These are the seminiferous tubules. The seminiferous tubules produce sperm cells through spermatogenesis. Anatomical position of the testes. The testes are located within the scrotum, with the epididymis situated on the posterolateral aspect of each testicle. Commonly, the left testicle lies lower than the right. They are suspended from the abdomen by the spermatic cord, a collection of vessels, nerves, and ducts that supply the testes. Originally, the testes are located on the posterior abdominal wall. During embryonic development, they descend the abdomen and through the inguinal canal to reach the scrotum. They carry their neurovascular and lymphatic supply with them. Anatomical structure of the testes. The testes have an ellipsoid shape. They consist of a series of lobules, each containing seminiferous tubules supported by interstitial tissue. The seminiferous tubules are lined by sertoli, cells that aid the maturation process of the spermatozoa. In the interstitial tissue lie the Leydig, cells that are responsible for testosterone production. Spermatozoa are produced in the seminiferous tubules. The developing sperm travels through the tubules, collecting in the reedy testes. Ducts known as efferent tubules transport the sperm from the reedy testes to the epididymis for storage and maturation. Inside the scrotum, the testes are covered almost entirely by the tunica vaginalis, a closed sac of parietal peritoneal origin. that contains a small amount of viscous fluid. This sac covers the anterior surface and sides of each testicle and works, much like the peritoneal sac, lubricating the surfaces of the testes and allowing for friction-free movement. The testicular parenchyma is protected by the tunica albuginea, a fibrous capsule that encloses the testes. It penetrates the parenchyma of each testicle with diaphragms, dividing it into lobules. The epididymis consists of a single heavily coiled duct. It can be divided into 3 parts, which include head. This is the most proximal part of the epididymis. It is formed by the efferent tubules of the testes, which transport sperm from the testes to the epididymis. Body. This is formed by the heavily coiled duct of the epididymis. Tail. This is the most distal part of the epididymis. It marks the origin of the vas deferens, which transports sperm to the prostatic portion of the urethra for ejaculation. Innervation of the testes. The testes and epididymis receive innervation from the testicular plexus, a network of nerves derived from the renal and aortic plexi. They receive autonomic and sensory fibers. Vascular supply of the testes. The main arterial supply to the testes. An epididymis is via the paired testicular arteries, which arise directly from the abdominal aorta. They descend down the abdomen and pass into the scrotum via the inguinal canal, contained within the spermatic cord. However, the testes are also supplied by branches of the cremasteric artery from the inferior epigastric artery and the artery of the vas deferens from the inferior vesical artery. These branches give anastomosis to the main testicular artery. Venous drainage is achieved via the paired testicular veins. They are formed from the pampiniform plexus in the scrotum, a network of veins wrapped around the testicular artery. In the retroperitoneal space of the abdomen, the left testicular vein drains into the left renal vein, while the right testicular vein drains directly into the inferior vena cava. Lymphatics of the testes. Since the testes are originally retroperitoneal organs, the lymphatic drainage is to the lumbar and paraortic nodes, along the lumbar vertebrae. This is in contrast to the scrotum, which drains into the nearby superficial inguinal nodes. 4. Epididymis. Your epididymis is a long, coiled tube that rests on the back of each testicle. It carries and stores the sperm cells that your testicles create. Your epididymis also brings the sperm to maturity. The sperm that emerge from your testicles are immature and incapable of fertilization. During sexual arousal, muscle contractions force the sperm into your vas deferens. The internal parts of the female reproductive system include 1. Vagina. The vagina is a muscular canal that joins the cervix, the lower part of the uterus, to the outside of the body. It can widen to accommodate a baby during delivery and then shrink back to hold something narrow like a tampon. It's lined with mucous membranes that help keep it moist. 2. Cervix. The cervix is the lowest part of the uterus. A hole in the middle allows sperm to enter and menstrual blood to exit. The cervix opens, dilates, to allow a baby to come out during a vaginal childbirth. 3. Uterus. The uterus is a hollow, pear-shaped organ that holds a fetus during pregnancy. The uterus is divided into 2 parts, the cervix and the corpus. The corpus is the larger part of the uterus that expands during pregnancy. 4. Ovaries. Ovaries are small, oval-shaped glands that are located on either side of the uterus. The ovaries produce eggs and hormones. 5. Fallopian tubes. These are narrow tubes that are attached to the upper part of the uterus and serve as pathways for the egg, ovum, to travel from the ovaries to the uterus. Fertilization of an egg by sperm normally occurs in the fallopian tubes. The fertilized egg then moves to the uterus, where it implants into the uterine lining. The female reproductive system provides several functions. In addition to allowing a person to have sexual intercourse, it also helps a person reproduce. The ovaries produce eggs. These eggs are then transported to the fallopian tube during ovulation where fertilization by a sperm may occur. The fertilized egg then moves to the uterus, where the uterine lining has thickened in response to the normal hormones of the menstrual cycle, also called the reproductive cycle. Once in the uterus, the fertilized egg can implant into the thickened uterine lining and continue to develop. If implantation doesn't take place, the uterine lining is shed as the menstrual period. In addition, the female reproductive system produces sex hormones that maintain the menstrual cycle. During menopause, the female reproductive system gradually stops, making the female hormones necessary for the menstrual cycle to work. At this point, the menstrual cycle scan becomes irregular and eventually stops. A woman is considered to be menopausal when she's gone an entire year without a menstrual period. What are the internal parts of the male reproductive system? There are several internal, accessory organs in the male reproductive system. They include 1. Spermatic cord. The spermatic cord refers to a collection of vessels, nerves, and ducts that run to and from the testes. They are surrounded by fascia, forming a cord-like structure. Anatomical course of the spermatic cord. The anatomical course of the spermatic cord is relatively short, beginning in the inferior abdomen and ending in the scrotum. The spermatic cord is formed at the opening of the inguinal canal, known as the deep inguinal ring. This opening is located laterally in the inferior epigastric vessels. The cord passes through the inguinal canal, entering the scrotum via the superficial inguinal ring. It continues into the scrotum, ending at the posterior border of the testes. Here, its contents disperse to supply the various structures of the testes and scrotum. Facial coverings of the spermatic cord. The contents of the spermatic cord are mainly bound together by 3 facial layers. They are all derived from the anterior abdominal wall. These include external spermatic fascia, derived from the aponeurosis of the external oblique muscle. Cremaster muscle and fascia, derived from the internal oblique muscle. Internal spermatic fascia, derived from the transversalis fascia. The 3 facial layers themselves are covered by a layer of superficial fascia, which lies directly below the scrotal skin. The cremaster muscle forms the middle layer of the spermatic cord fascia. It is a discontinuous layer of striated muscle that is orientated longitudinally. Contents of the spermatic cord. The spermatic cord conveys several important structures that run to and from the testis. Blood vessels of the spermatic cord include testicular artery. This is the branch of the aorta that arises just inferiorly to the renal arteries. Cremasteric artery and vein. This supplies the cremasteric fascia and muscle. Artery to the vas deferens. This is the branch of the inferior vesical artery, which arises from the internal iliac. Pampiniform plexus of testicular veins. This drains venous blood from the testes into the testicular vein. Nerve supply of the spermatic cord. These include genital branch of the genitofemoral nerve, which supplies the cremaster muscle. Autonomic nerves. Other structures of the spermatic cord. Vas deferens, the duct that transports sperm from the epididymis to the ampulla, a dilated terminal part of the duct, is ready for ejaculation. Processus vaginalis, projection of peritoneum that forms the pathway of descent for the testes. During embryonic development, in the adult, it is fused shut. Lymph vessels. These drain into the paraortic nodes, located in the lumbar region. Pampiniform plexus. The pampiniform plexus is a network of veins responsible for the venous drainage of the testes. It has a unique configuration, wrapping itself around the testicular artery. The testes function best at a temperature just below that of the body. The pampiniform plexus acts as a heat exchanger, cooling the arterial blood before it reaches the testes. As it travels through the inguinal canal, the pampiniform plexus condenses into a single testicular vein. The right testicular vein drains into the inferior vena cava, and the left testicular vein drains into the left renal vein. However, some anastomotic branches allow communication with other veins, such as the cremasteric, scrotal, and internal pudendal veins. 2. Vas deferens. The vas deferens is a straight, thick muscular tube that conveys sperm from the epididymis to the ampulla and eventually to the ejaculatory duct formed by the convergence of the vas deferens and seminal vesicle duct. From the ejaculatory duct, sperm can pass through to the prostatic urethra. Your vas deferens is a long, muscular tube that travels from the epididymis into your pelvic cavity, just behind your urinary bladder. Your vas deferens transports mature sperm to the urethra in preparation for ejaculation. The wall of the vas deferens consists largely of smooth muscle, arranged in 3 muscle layers, which include inner layer, the longitudinal smooth muscle, intermediate layer, the circular smooth muscle, outer layer, the longitudinal smooth muscle. There is a rich autonomic innervation of these muscle fibers, which permits fast movement of sperm towards the ejaculatory duct. This movement is also facilitated by the inner mucosal layer of the vas deferens, which is lined by cells that possess microvilli. Their seaweed-like movement helps advance spermatozoa through the spermatic tube. The anatomical course of the vas deferens is as follows. It is continuous with the tail of the epididymis, travels through the inguinal canal as part of the spermatic cord, moves down the lateral pelvic wall close to the ischial spine, turns medially to pass between the bladder and the ureter, and then travels downward on the posterior surface of the bladder. The inferior narrow part of the ampulla joins the duct from the seminal vesicle to form the ejaculatory duct. 3. Ejaculatory ducts. Each testicle has a vas deferens that joins with seminal vesicle ducts to form ejaculatory ducts. The ejaculatory ducts move through your prostate, where they collect fluid to add to semen. They empty into your urethra. Structure of the ejaculatory duct. The ejaculatory duct is a muscular tube, approximately 2 centimeters long, that is formed by the union of the duct of the seminal vesicle and the ampulla of the ductus deferens. Small openings of the ejaculatory duct open on both sides, or within, the prostatic utricle, to open into the prostatic urethra. Anatomical relations of the ejaculatory duct. The ejaculatory duct is located posterior to the bladder and superior portion of the prostate gland. Function of the ejaculatory duct. During ejaculation, the ejaculatory duct dilates and propels sperm and seminal fluid into the prostatic urethra and subsequently out of the body via the external urethral orifice. Arterial supply of the ejaculatory duct. The ejaculatory duct is supplied by the inferior vesical artery, which is a branch of the internal iliac artery. Venous drainage of the ejaculatory duct. The ejaculatory duct is drained by the prostatic and vesical venous plexus, which drains into the internal iliac vein. Innervation of the ejaculatory duct. During ejaculation, the hypogastric nerve controls rapid contraction of the ejaculatory duct by way of the sympathetic nervous system. Lymphatic drainage of the ejaculatory duct. The lymph of the ejaculatory duct is drained into the internal iliac lymph nodes. 4. Urethra. Male urethra. The male urethra is approximately 15 to 20 centimeters long. In addition to urine, the male urethra transports semen, a fluid containing spermatozoa and sex gland secretions. According to the latest classification, the male urethra can be divided anatomically into 3 parts, proximal to distal, which include prostatic urethra, begins as a continuation of the bladder neck and passes through the prostate gland, receives the ejaculatory ducts containing spermatozoa from the testes and seminal fluid from the seminal vesicle glands, and the prostatic ducts containing alkaline fluid. It is the widest and most dilatable portion of the urethra. Membranous urethra passes through the pelvic floor in the deep perineal pouch, surrounded by the external urethral sphincter, which provides voluntary control of micturition. It is the narrowest and least dilatable portion of the urethra. Penile, bulbous, urethra passes through the bulb and corpus spongiosum of the penis, ending at the external urethral orifice, the meatus. Receives the bulbourethral glands proximally in the glands head of the penis. The urethra dilates to form the navicular fossa. Neurovascular supply of the urethra. The arterial supply to the male urethra is via several arteries, which include prostatic urethra, supplied by the inferior vesical artery, branch of the internal iliac artery, which also supplies the lower part of the bladder. Membranous urethra. supplied by the bulbourethral artery, branch of the internal pudendal artery. Penile urethra, supplied directly by branches of the internal pudendal artery. The nerve supply to the male urethra is derived from the prostatic plexus, which contains a mixture of sympathetic, parasympathetic, and visceral afferent fibers. Lymphatic drainage of the urethra. Lymphatic drainage also varies according to the region of the urethra. The prostatic and membranous portions drain to the obturator and internal iliac nodes, while the penile urethra drains to the deep and superficial inguinal nodes. 5. Seminal vesicles. The seminal vesicles, also known as the vesicular or seminal glands, are a pair of glands found in the male pelvis, which function to produce many of the constituent ingredients of semen. They ultimately provide around 70% of the total volume of semen. Your seminal vesicles are sac-like pouches that attach to your vas deferens near the base of your bladder. Seminal vesicles make up to 80% of your ejaculatory fluid, including fructose. Fructose is an energy source for sperm and helps them move, motility. Anatomical position and structure of the seminal vesicles. The seminal glands are a pair of 5 cm long tubular glands. They are located between the bladder fundus and the rectum, separated from the latter by the rectovesical pouch and the rectoprostatic fascia. Their most important anatomical relation is with the vas deferens, which combine with the duct of the seminal vesicles to form the ejaculatory duct, which subsequently drains into the prostatic urethra. Internally, the gland has a honeycombed, lobulated structure with a mucosa lined by pseudostratified columnar epithelium. These columnar cells are highly influenced by testosterone, growing taller with higher levels, and are responsible for the production of seminal secretions. Embryology of the seminal vesicles. The seminal glands, along with the ejaculatory ducts, epididymis and ductus, vas deferens, are derived from the mesonephric ducts, the precursor structure of male internal genitalia. Function of the seminal vesicles. The secretions of the seminal gland have a key role in the normal functioning of semen, making up 70% of its total volume. It is notable, however, that the first fractions of expelled semen contain mainly spermatozoa and prostatic secretions. The fluids from the seminal vesicles are included in the late ejaculate fractions. These fluids contain alkaline fluid, which neutralizes the acidity of the male urethra and vagina to facilitate the survival of spermatozoa. Fructose, which provides an energy source for spermatozoa. Prostaglandins, which play a role in suppressing the female immune response to foreign semen. Clotting factors. This is designed to keep semen in the female reproductive tract post-ejaculation. The remaining volume of semen is made up of testicular spermatozoa, prostatic secretions, and mucus from the bulbourethral gland. Vasculature of the seminal vesicles. The arteries to the seminal gland are derived from the inferior vesicle, internal pudendal, and middle rectal arteries, all of which stem from the internal iliac artery. Innervation of the seminal vesicles. The innervation of the gland, like much of the male internal genitalia, is mainly sympathetic in origin. You can use the classic memory aid point and shoot to remember this. Erection, or pointing, receives parasympathetic innervation, while ejaculation, including contraction of the smooth muscle of the seminal vesicles, receives sympathetic innervation. Lymphatic drainage of the seminal vesicles. The lymphatic drainage of the gland is the external and internal iliac lymph nodes. 6. Prostate gland. The prostate is the largest accessory gland in the male reproductive system. It secretes proteolytic enzymes into the semen, which act to break down clotting factors in the ejaculate. This allows the semen to remain in a fluid state, moving throughout the female reproductive tract for potential fertilization. Your prostate is a walnut-sized gland that rests below your bladder, in front of your rectum. Your prostate adds additional fluid to ejaculate, which helps nourish sperm. Your urethra runs through the center of your prostate gland. Anatomical position of the prostate. The prostate is positioned inferiorly to the neck of the bladder and superiorly to the external urethral sphincter. with the levator ani muscle lying inferolateral to the gland. Posteriorly to the prostate lies the ampulla of the rectum. This anatomical arrangement is utilized during digital rectal examinations, DRE, allowing physicians to examine the gland. The proteolytic enzymes leave the prostate via the prostatic ducts. These open into the prostatic portion of the urethra through 10 to 12 openings at each side of the seminal colliculus, or verumontanum, secreting the enzymes into the semen immediately before ejaculation. Anatomical structure of the prostate. The prostate is commonly described as being the size of a walnut. Roughly 2/3 of the prostate is glandular in structure and the remaining third is fibromuscular. The gland itself is surrounded by a thin, fibrous capsule of the prostate. This is not a real capsule. It rather resembles the thin connective tissue known as adventitia in the large blood vessels. Traditionally, the prostate is divided into anatomical lobes, inferoposterior, inferolateral, superomedial, and anteromedial by the urethra and the ejaculatory ducts as they pass through the organ. However, more important clinically is the histological division of the prostate into 3 zones, which include central zone. This surrounds the ejaculatory ducts, comprising approximately 25% of normal prostate volume. The ducts of the glands from the central zone are obliquely emptying in the prostatic urethra, thus being rather immune to urine reflux. Transitional zone. This is located centrally and surrounds the urethra, comprising approximately 5 to 10% of normal prostate volume. The glands of the transitional zone are those that typically undergo benign hyperplasia, BPH. Peripheral zone. This makes up the main body of the gland, approximately 65%, and is located posteriorly. The ducts of the glands from the peripheral zone are vertically emptying in the prostatic urethra, which may explain the tendency of these glands to permit urine reflux. That also explains the high incidence of acute and chronic inflammation found in these compartments, a fact that may be linked to the high incidence of prostate carcinoma in the peripheral zone. The peripheral zone is mainly the area felt against the rectum on DRE, which is of irreplaceable value. The fibromuscular stroma, or fourth zone for some, is situated anteriorly in the gland. It merges with the tissue of the urogenital diaphragm. This part of the gland is the result of the interaction of the prostate gland budding around the urethra during prostate embryogenesis and the common horseshoe-like muscle precursor of the smooth and striated muscle that will eventually form the internal and external urethra, sphincter, vasculature of the prostate. The arterial supply to the prostate comes from the prostatic arteries, which are mainly derived from the internal iliac arteries. Some branches may also arise from the internal pudendal and middle rectal arteries. Venous drainage of the prostate is via the prostatic venous plexus, draining into the internal iliac veins. However, the prostatic venous plexus also connects posteriorly by networks of veins, including the Batson venous plexus, to the internal vertebral venous plexus. Innervation of the prostate. The prostate receives sympathetic, parasympathetic, and sensory innervation from the inferior hypogastric plexus. The smooth muscle of the prostate gland is innervated by sympathetic fibers, which activate during ejaculation. Neurovascular bundles of the prostate. The prostate is flanked by the 2 neurovascular bundles that travel through the pelvic floor towards the penis, supplying it with nerve fibers and blood vessels for the corpora cavernosa. The integrity of these bundles is critical for normal erection. During surgery for prostate cancer, radical prostatectomy, damage is often inevitable to one or both of these bundles, resulting in impairment of erectile function. Special nerve-sparing techniques may prevent extensive damage to these bundles, thus allowing for postoperative potency. Prostate-specific antigen. The prostate-specific antigen, PSA, is an enzyme, serine protease, secreted by the prostatic epithelium that aids the liquefaction of the ejaculate by lysing seminal vesicle proteins. However, the main clinical use of PSA is as a tumor marker specific for prostate carcinoma. Increased levels of serum PSA may suggest the presence of prostate cancer. Nonetheless, other conditions that may irritate the prostate, such as inflammation, severe constipation, extended sexual intercourse, or catheterization, may also increase the PSA levels in the serum. 7. Bulbourethral Cooper glands. Your bulbourethral glands are pea-sized structures on the sides of your urethra, just below your prostate. They create a clear, slippery fluid that empties directly into your urethra. This fluid lubricates your urethra and neutralizes any acids that may remain from your pee. The bulbourethral glands, also known as Cooper's glands, are a pair of pea-shaped exocrine glands located posterolateral to the membranous urethra. They contribute to the final volume of semen by producing a lubricating mucus secretion. Anatomical position and structure of the bulbourethral glands. On dissection, the bulbourethral glands can be found in the deep perineal pouch of the male. They are situated posterolaterally to the membranous urethra and superiorly to the bulb of the penis. The ducts of the gland penetrate the perineal membrane alongside the membranous urethra and open into the proximal portion of the spongy urethra. The glands themselves can be described as compound, tubuloalveolar glands, lined by columnar epithelium. Embryology of the bulbourethral glands. Embryologically, the bulbourethral glands are derived from the urogenital sinus, along with the bladder, prostate, and urethra. Their development is greatly influenced by DHT, dihydrotestosterone. Function of the bulbourethral glands. During sexual arousal, the bulbourethral glands produce a mucus secretion containing glycoproteins. This substance has three main purposes, which include: serves as lubrication medium for the urethra and the tip of the penis, expels any residue of urine, dead cells, or mucus through the urethral meatus, preparing a clean and lubricated pathway for ejaculation, helps to neutralize residual acidity in the male urethra. Secretions are alkaline. Normally, these secretions are devoid of any spermatozoa, as ejaculation occurs further down at the prostatic urethra level. However, occasionally these secretions, also known as pre-ejaculate, may carry spermatozoa that remain in the urethra after a previous ejaculation. Keep in mind that spermatozoa in body temperature survive for more than 48 hours. This may be obviated by urination and thus washing out the urethra. However, although rare, it may represent a cause of unintended pregnancy during unprotected sexual intercourse. Vasculature of the bulbourethral glands. The arterial supply of the bulbourethral glands is derived from the arteries to the bulb of the penis. Innervation of the bulbourethral glands. In a mammal study, in pigs, neurons projecting to the bulbourethral glands were found in the pelvic ganglia, PG, sympathetic chain ganglia, L2, S3, the caudal mesenteric ganglion and dorsal root ganglia, L1, L3, S1, S3. They reach the bulbourethral glands via the hypogastric nerve and the pelvic nerve or pelvic branch of the pudendal nerve. Lymphatics of the bulbourethral glands. Like the seminal vesicles, the bulbourethral glands drain into the internal and external iliac lymph nodes.